career development is not promotions. Promotions come with your career development, right? Experiences, ways of doing things, learning something new. And if you do them and excel and become more valuable to the company, you will be promoted. But most people, again, this is another one. I want to talk about career development. Okay, when am I going to be promoted next? It's like, oh, that's a different conversation. Career development and promotion are completely different conversations, at least the way that I handle it with my staff.
Yeah.
Welcome to the BioTalk Unzipped podcast, where we unzip the stories behind medical progress by sharing the latest and greatest advances in biopharmaceuticals and medical technologies in a fun, entertaining, and enlightening format. And now your co-hosts, Gregory Austin and Dr. Chad Briscoe. Hi, everyone, and welcome to BioTalk Unzipped, where we unzip the stories behind medical progress in a fun and intriguing manner. I'm your host, Gregory Austin, and here with me, my illustrious co-host, Dr. Chad Briscoe. And in this episode, episode 4, this will be the continuation of our great conversation with our good friend, Dr. Russ Weiner.
I want you to be brutal to the gene and cell therapy industry right now. Okay, so we're supposed to be unzipping the biotech industry. Where is gene and cell therapy really going? Is it going to bankrupt the insurance industry? Is it a miracle cure? Those are the headlines, right? Depending on the agenda. Bankrupt insurance because of the cost of drugs, miracle cure, which there's some truth in both maybe, but I want to hear it from an industry insider, somebody who's really thinking about putting drugs forward in this space.
So in all fairness, I'll say that I was a huge skeptic. The fact that I'm supporting cell therapy, if you asked me 5 years ago, would have never happened. I'm not going anywhere near that. And the rationale there wasn't the biology. I think the biology can be figured out and has been figured out. It was, as you said, the costs. I was looking at that and seeing the cost of biologics and how they struggled in the early days of getting a $25,000 therapy several times a year. And I was doubtful that they could do that, but I knew those drugs really, really worked. The jury's out, even though there's a couple really, great items, great therapeutics that are out there. The jury's out because we still don't understand much of the immunology, getting back to why we do so much flow cytometry. But moving from an autologous, where an individual is his own manufacturing site, right? You take that individual's cells, bring them to the lab, modify them, put them back in. Those are tough. I can't see the industry really sustaining that. And now go over to the allo side, where we develop those cells and we aliquot them out after they've been modified. Now they're on the shelf, in the hospitals, and whether it's 10 vials or 100 vials, the idea that we can get a cell to work in everybody with limitations, of course, is where I think it's going to go. On the gene side, it's a tough one. If you look at all the companies that focus on these rare diseases, you understand that they're going to sell this. There's 100 people in the world that have this. How do you do that study? That's a little bit more challenging to me. But when I see cell and gene therapy or gene therapy and dealing with something like sickle cell,
I was going to mention
that is a big market, right? This is something that we've been challenging. So I think the ability to get some that are a little bit more widespread illnesses to support those that are more rare, and philanthropic organizations have to help here as well. Until we get to a point where it is just rote and we can do this, it's always going to come up. And I don't know what insurance companies are going to do today. We see some covered, but ex-US, I really don't know. But I would expect other areas around the world, this is just not going to be applicable. They're not going to be able to do it. But what I've seen in the short time I've been at Takeda in cell therapy, it is amazing what they can make these cells do. And if you look at as I'm going through Instagram and this is not cell or gene therapy, but the idea that you can see cardiac cells begin to coalesce and beat in a petri dish, that's the level of the stuff that they're doing. And it's not just put a a CAR T in. It's a CAR T with a bunch of other armoring type strategies where you have other molecules on the surface to either protect, augment, or help them survive. It's nothing that I expected, but that cost is going to have to be figured out by someone.
Right. Right.
It's
This is
only
such
the
a huge
beginning.
win.
It
Yeah,
is
it
only
is.
the beginning.
It is,
Yeah.
and I'm excited for the new sickle cell therapy that has come out. Right, that's a
Yep.
big win, and it has the potential to help a lot of people. I did see that there was a chance, right, that it could cause some fertility issue in women. But the big thing to me is, okay, well, this is great, but what percentage of that population, even in the U.S., is going to feel like they can afford this? And how are insurance companies? We don't even know yet how they're going to deal with this. They're probably at the drawing board right now trying to figure that out.
And if you go over to biologics, if you watch the TVs and you get past all the music and the dancing and the pump and circumstance that you see on commercials and actually listen to the side effects, cancer is, one of the side effects. What is the benefit risk, for individuals with debilitating RA or debilitating sickle cell that is going to shorten their life? It's just it's people who have RA already have a higher incidence of cardiac issues. Okay, we're going to get rid of the cardiac issues. Now we introduce something else. But how rare is it relative to the cardiac issues? Same thing with the gene therapies as well. It has to beat out that risk benefit. It just has to prove it to the advisory boards.
Very good. Wow. We'll see what happens. Time will tell, right?
Yeah, I'm glad I'm on the science side and not the payer side, not the insurance side. That's for sure, man. That doesn't seem like a fun piece to solve. But I guess if that's the industry you go into, and that's where you come up through it, you probably love figuring out those challenges because they're big ones and they're tough problems to solve, and so there probably are people who love to dive into those and are every bit as smart as all of us scientists out here. So yeah, so it'll be interesting to see how they solve that one.
And the thing is, we all have someone, whether it's a friend or family, that has one of these rare diseases. Mm-hmm. And you would do anything. You would pay anything to do it. Unfortunately, most people can't. Even the rich, would struggle with some of these therapies. But the look on a parent's face when their child can walk again, or if you know people with cystic fibrosis, or some of these other awful diseases, we don't think about the money. The scientists don't think about the money. We just want it to work, and hopefully it'll work itself out on how to get those therapies to those individuals.
So changing gears a little bit, we want to talk a little bit about your role in AAPS. So you were recently president-elect of AAPS. Would love to understand what drove you to that. Reading your biography, it's like, man, this guy is busy, and he says, "Hey, I'll take on leadership for this massive, diverse organization." What's your motivation? Where do you see the organization going? What are some of your goals going forward with it?
So one would say I'm crazy, right? But I said earlier,
I said that before.
No, it's a known fact.
Before the AAPS.
I'm a little bit, but as we said before, don't pass up opportunities. So I've run for AAPS probably for the last AAPS president, probably for I'm going to say 10 years. So ish, and I lost twice. Lost to some amazing, world-class individuals. So they called me again. They said, do you want to do it? I was like, do I want to do this again? And I did. And I tell you, AAPS made me who I am today. I would be a fraction of what I am today if it wasn't for AAPS. Mm-hmm. and meeting, you two, through an AAPS or other scientific societies. But my passion with AAPS are the students, right? I was one of the first people to introduce student representation to the different committees. And now these individuals, fast forward 20 years, are in leadership positions. They have exceeded my title and influence. They have exceeded. But the one thing that there was two things that I've always been extremely passionate about, and I try to bring this to AAPS. One is pediatrics, pediatric drug development. And if you remember a number of years ago, I had a woman who at 16 had a heart attack, wound up losing her heart. She had to have a heart transplant. She lost a limb because of this, put on immunosuppressant therapy for the heart, developed cancer, and passed away, recently. But I had her on the stage. I'll choke up again here. I had her on the stage for one of the meetings that I was chairing. And to date, she was the only keynote speaker that ever got a standing ovation. And every once in a while, her name comes forward, and I realized that and I wanted to be a pediatrician before I wanted to be a researcher. So that's a huge passion of mine. And the other one is global health. And this is the reason why I left, pharma to go to a startup company. I always wanted to do startup, but I didn't embrace the fear because the Gates was it was a guaranteed 10-year term in terms of 10 or 15 years of funding. So I knew if a drug failed, I wouldn't be out, looking for another job. So it's a little bit of a cheat to go into that space. But let me tell you, the first time you walk into a TB ward, or you walk into a hospital where there's 20 women lined up in beds, all giving birth around one another, people sitting in the halls, this is a huge, huge passion of mine. And that's basically if you look at what I ran on, what the committee evaluated, it was on global health. My feeling, and particularly in infectious disease, every disease is only a flight away. We learned that with COVID. So let's really do what we really need to do. These people need our help. They're in situations that generally are not of their doing. And I'll tell you, some of the best science is done outside the U.S. in some of these small and middle income, low and middle income countries. South Africa is amazing. It's absolutely amazing. We talked about flow and PBMC prep. There's a whole network. Generally, that came not from TB, but from the HIV crisis. And they built up these incredible networks. So there are these amazing areas that, I was biased. I didn't, I wasn't sure what to expect. Now, having said that, you go into some other low and middle income countries and you have to build. And what I'd like to be able to do is get some of these scientists, train them up, in the US, send them back to take the best information. And then the second piece is recently joining the governance board of Fight Cancer. And there too, it's all about individuals who get cancer, and in many of these areas are kind of pushed to the side, right? I'm not going to say shunned, but they're of no value, to some of these areas, right? Particularly if it's the mother who really makes sure that the family is fed and works well. And these individuals are left alone to fend for themselves. So one of the major tenets of the Fight Cancer Group is to eliminate the loneliness, the isolation that comes with cancer treatment or any terrible disease. If you look at people who have HIV, nobody wanted to go pick up their meds, because if someone saw you picking up your HIV meds, now that's you're kind of outed. Same thing with with TB and a number of other diseases. So I'm hoping next year when I do become president, we can do some things to at least bring them in and foster those relationships.
Wow, Russ, I voted for you. So as an AAPS member, and I'm glad I did.
Yeah.
But I'll tell you, it's a personal side, but my role as the bioanalytical community leader, I'm now the past chairperson of the bioanalytical community. Let me know where I can help you, because man, I don't think I'm going to come work for you at Takeda, as exciting as that sounds. But man, if I can help you achieve your mission in AAPS, that's exciting. I mean, I'll be there one way or the other. So,
And I
yeah.
tell you, interestingly, your sentiment is very common. So there's a pent up desire to help people. We do it the way we're used to in the Western world. But let me tell you, you go over there and you see things. It was like my first trip to India, or a recent, actually, I'll tell a different story. A recent trip to India where we went to one of the public-private hospitals, and we were on the public side in a NICU because we were looking to one of the missions of the Bill and Melinda Gates Medical Research Institute is to prevent death due to prematurity. I've never seen a real premature baby. Like, I mean, sub-kilogram size babies, and they had 2 or 3, sitting in an incubator. It's it's life changing, and I think if more people are just exposed to that, just see it, you're going to see the volunteerism, go up. You're going to see people who are going to really, think of things that will bring the world to a better place, and stop thinking about just my well-being. And as I said, I got a couple more drugs left in me. And that's,
Nice.
one of the reasons I'm going, whether it's oncology or another therapeutic area, the whole idea is to make a difference, go home at night, listen to, Thanksgiving and Christmas, 2 times where you have to listen to old people at the table complain about drug costs, pharmaceutical companies, and the fact that cancer's been cured 10 years ago. So,
Yeah. Yeah, no, I hear you. And I remember going to India about 10 years or more ago now for APA India. And it was very eye opening, just the abject poverty that yet you witness just being out there, and young kids, maybe 8, 9, 10 years old, holding infants, walking around traffic, just looking for anything that they can get. And how we live in a bubble, for the
we
most
do.
part, right? We don't really think about it, and my kids live in that as well. And what was really remarkable is when we were getting some volunteer help from the university to run that conference. It was their response. Not only was just overwhelming to join in and be around the science and the scientists and the talks, but just the gratitude they had just to be there and to be lucky enough. And I think that sometimes gets lost in our kids and in education. It's like, do your homework, and it's such a it's a battle. And in other parts of the world, it's really it's a gift to have the opportunity to have education. So I think you make a really good point there. So Russ, what is maybe one of the most or the most surprising thing that you've encountered throughout your career?
Oh, wow. That's an interview question. I guess surprising is how long and how much money it takes to get a therapeutic out there.
Hmm.
And it breaks my heart when, the pharmaceutical industry gets beat up, sometimes for good reasons, but, many times not. And if I look at my staff and the hours they spend without their family, they're my work family. Your work wife, your work husband, your work kids. Nothing is more demotivating than those kind of conversations, knowing that we don't see this. Right? Vast majority of the people in the pharmaceutical companies, they're there to do something good. As I said, I went in it for multiple sclerosis. Family members have had cancer. When someone gets cancer, I usually get a phone call, and then I try to, move them around to different experts that I've, met. But that cost and the time. I mean, I think the first drug I worked on, it took 10 plus years before that drug was actually approved. It's shocking. There are, drugs that I'll leave a company and then I'll see like 10 years later what's going on. It's still there. So I think that's the most surprising. The other thing that's surprising is when AI came out recently, the whole world changed. Absolutely changed with the launch of ChatGPT. Right? I didn't know what AI was. To me, AI was reading tumors or TB in an X-ray automatically. Right? So in Peru, there's a van. It has a portable X-ray, They have like a carnival atmosphere because they just want to screen. Let's get everybody screened. If they test positive, there's a doctor right there to get them on meds immediately. You don't want them to leave. You want them to get right on the meds. But they don't have pathologists, sitting, in each one of these vans. And so what they have is someone developed, an algorithm that's able to look at a lung X-ray and find tuberculosis. Side project there, or side thing that happened, they started to find cancer as well. So it seems that AI is in places that I just don't understand how it's there. But when I learn, it's like, how did I live without this? I mean, there's some downsides to it, but I'll tell you, everything we do has an AI component now.
What do you think the potential is of AI to shorten that R&D time gap, from beginning to to registration, and will it make it less expensive, do you think, to develop drugs?
I would hope so. In terms of where it really helps, if we're developing, for example, algorithms, ways of diagnosing cancer in very, very complex ways, right? So you're a pathologist, you can only look at so many things on that slide, right? You're human, right? And um, individuals that read and read and read, they know what to look for. Give them a 10 parameter model. No, it's just not possible. So I see
Right.
the ability to use very novel algorithms that are trained, via AI technology as a way to bring, some of those therapeutics definitely faster, or bring them, period, that otherwise we wouldn't use. I remember working on Keytruda, and we had, card carrying pathologists trying to figure out how to score these things. I can only imagine now if you had dozens and dozens of test cases, put it through the algorithm, and then come out with a way to automatically read that slide. Pathologists in the audience, don't worry, you'll always have a job, right? That's the, but the ability to see those things, to do spatial, to do spatial transcriptomics and looking at a whole cell or a whole tissue, not a whole cell. They also do it for cell, but a whole tissue, and the ability to read that
Mm-hmm.
in an evening. You load your sample up, you come in, the image, you load the image up, you come in the next morning, and it's there for you. That would take, I don't know how long. So yes, in the early discovery space, especially, that they can move through images quickly, the ability to take, multi-parameter models and combine flow cytometry, genomics, and then spatial transcriptomics, put all that together. No one can do that. You're relying on computers that can take days to crunch some of those numbers. But with AI, it's an overnight thing, or it happens in real time.
Wow. That's something we can look forward to it'll continue to develop. And I think it's on a logarithmic path of improving technology. It's not linear.
Nope.
It's going to keep improving and moving at a factor that's going to be mind boggling, I think.
I need to be trained at it a lot more. I'll tell you that. It is
Yeah.
every day something's new.
It is. It's hard to keep
Yeah.
up.
Yeah.
So let's switch gears a little bit. Now, I know over the years you've been an avid scuba diver and had a lot of fun doing that. And what would you say, what is your favorite dive? Where was that?
Favorite dive is got to be Socorro. Now, Socorro is a set of basically uninhabited islands south of Baja Peninsula.
Okay.
Takes about a day on a boat. You stay on the boat for the whole trip.
Sure.
And being a little chubby, I'm chubby, right? Being a little chubby, going in the water and exerting yourself to a level of, oh my God, my heart's going to blow out of my chest. But you do that to see these 25-foot wide manta rays that, they just float over you. It's amazing. They like the bubbles from your regulators to tickle their bellies. And I'll tell you, when they hit you in the head, they don't move, but they'll send you straight down. It's like a rocket when they whack you on the head.
Dang.
But But the scuba diving thing, I'll give you an aside, and that is my whole family scuba dives, and I wanted my sons to do this as well. Why? Well, I think it's a great hobby. You get to see different places of the world, but getting back to the low middle income country, they get to see how people live, and that what they have is a blessing, and it's something that they have to work hard at to maintain and excel, and the world isn't what we see just in the U.S. And I'll tell you, it really changed their outlook when you pass by and you see people with no shoes and living in shacks. So that's kind of a side project. And whenever we go, particularly if we're going to the Philippines or Indonesia, we always sponsor some sort of drive to bring in money to buy a washing machine, to buy backpacks for the kids in school. So each dive, each dive trip, has something that is associated with that, and those tend to be the dive ops that we focus on, those that are giving back to their local communities.
That's awesome. What a great way to marry a hobby with a philanthropy and really do something good to the world at the same time.
And you haven't lived until a giant sea lion opens his mouth in your face. And the dive master said, when that happens, put your head down. And I, honest to God, thought I was going to have my head bit off. It didn't stop me from doing it a second time because it was pretty thrilling. But
my experience in diving is when the dive master tells you to do something, you damn well better do it. and it may be for your safety. It may be for fun. It may be just so you don't get lost. There's all sorts of different reasons the dive master tells you to do something. You can't second guess it, man, because
nope.
Because there's always a reason, and it's usually a really good one. Those guys they're serious. So I'll tell you, Russ, one of these days, I don't think you've ever met my brother, have you?
Mm-mm.
So when I'm in Boston, we got to get together one time because two things that come up now. One is that he works at Cerevel. They're developing MS drugs, right? So,
cool.
So I was thinking about that as you were saying that, right? That's a lot of what they're doing. They just sold to AbbVie, so we'll see where that goes. But really move those drugs along. But the other thing is he's an avid scuba diver. So yeah, it'd be a lot of fun. We gotta all get together when I'm up there. But
I'd love it.
Yeah, awesome.
So good. Do you have like a really fun or, maybe the funniest memory you have in your career that you would like to share?
Funniest memory. Oh, there's lots of funny memories. Receiving a 50 mil conical with a fly in it. That was a pre-analytic fun thing.
Ooh.
I've
been trying to decide if I should tell this story or not. Russ, you'll probably remember, but I interviewed not to work for Russ many years ago, but to work in the group where he interviewed me at one of the companies, and I remember the advice you gave me, but I interpret it differently from what you said then. But you said, "Hey, Chad, first of all, you're fantastic. You're like, hey, bring your wife out. We want to, show you around and get, so it's really, really fantastic." And I remember you saying though, he goes, "Chad, whatever they offer you, ask for more money. They're gonna, and I was, it was maybe it was like 15 years ago now, I think. But anyways, but nonetheless, the way I interpret that now, and it really goes along with a lot of what you said throughout this discussion, is to know your worth, right? And to know that you have a value to the organization, you have something to contribute, and the company wants you and needs you, but you also have a value to that organization. So it's one thing to kind of say, yeah, make sure you hold out for more money, which was great advice. But for various reasons, it didn't end up taking the job, but yeah, just know your worth. So that was, that was kind of a funny situation that goes back a ways when I was just getting to know you some years ago.
So even there, that's the mentoring in me.
Yeah.
Right. If someone's going to uproot their lives, their family, their kids, I want them to be happy. I don't want them to, I'd rather they don't take the job. So I tend to be, probably contrary to what my companies would want me to be. I tend to be very honest with them, to, showing them, what are the warts of the organization. So when people come, they come educated, informed, and they they appreciate that level of honesty.
Yeah.
And when you talk about worth, one of the things I probably should have mentioned as a third thing for your colleague that says what to do to be successful, and that is surround yourself, one, with people that are better than you, and two, always find a mentor, someone who you can talk to that's not in your line management, that you could vent, someone who can keep that confidence. And those are the people that'll help you understand your worth. And they'll be honest with you. If you think you're much better than your worth, and they said, no, we're going to ground you. You don't ask for that. It's not going to happen.
No.
Yeah. Well, that's why I value this woman
Yeah.
working for me so much, because she's so much smarter than me, which I want everybody working for me to be smarter than me. That's exactly how it should be. Yeah.
Oh, well, that's great. And I think, from a retention standpoint, you save so much more money by not having to go and re-recruit and uproot and, do all that. So that's the way to do it. And people, it just builds trust.
Yeah.
And they feel like, oh, this is a trusting organization, someplace I want to be.
Yep.
I agree.
For sure.
I tell
Absolutely.
people, they control your own destiny. Right?
Mhm.
You control your own destiny.
Yep.
Or you can hope somebody will do it for you, and then you'll be sad. That's,
Yeah.
You'll be sad.
Yeah.
And you will be.
Yeah.
And
Yep.
most people believe that your boss, your supervisor, is in charge of your career. Well, they're in charge of you being employed, but they're not
Yep.
in charge of your career. You're in
Yep.
charge of your career.
Yep.
You need to think about what you want to do, what risks you want to take, and then it's your supervisor's responsibility to figure out how to get there. So it's just like Google Maps. You tell it where you want to go, and your supervisor is Google Maps. This is how we're going to get there. And in typical Google Maps, there's 3 or 4 different ways to get to the same place. So you may like one a little bit better than the other. And the key is really to have that supervisor who's flexible enough to provide you the opportunity to take road B instead of road A.
Yeah.
So again, it's your responsibility to take care of that. And honestly, I speak all over to university students, typically graduate students, and that is a shock to them. They really it's not taught in school that you have to drive your career.
Right.
And so as I go and teach soft skills to the different universities, it never fails. Doesn't matter what school I go to, how prestigious, how small, how large. It's at least 3/4 of the audience are shocked by the statement.
Wow. Yeah.
Yeah. Listen to this guy though, Greg. He's one of the leading scientists at one of the world's leading pharma companies. He says, I go teach soft skills to universities. That's so cool. Good. Yeah, that's cool. Awesome. Yeah.
And it's so needed.
Love the curiosity.
Yeah.
Because these are the people I will work for at some point.
Yeah. Yeah. Oh, it's so good. I think some of the best advice I also heard is along that vein. Instead of asking for a raise, say, hey, I want to get this. Don't make it binary. So, say, I've been with the company this long. I've been with some ups and downs. I'm really committed to being here. This is where I want to be from a salary perspective. How can you help me, or how can I get to that point? And then it's not binary. It's a journey. And they may see the value right away and make that change, or they'll help you get there instead of saying, hey, I deserve this. Give this to me. And then that leaves you in a bad position.
Yeah. And if I was going to give one piece of advice there, career development is not promotions. Promotions come with your career development, right? Experiences, ways of doing things, learning something new. And if you do them and excel and become more valuable to the company, you will be promoted. But most people, again, this is another one. I want to talk about career development. Okay, when am I going to be promoted next? It's like, that's a different conversation. Career development and promotion are completely different conversations, at least the way that I handle it with my staff.
Yeah. Put yourself, get the skills and put yourself in a position that promotion will come when it's available, and then it's not even a conversation. I mean, it's take charge of your own career and gain all the experiences you can, and it's all fantastic advice. Yeah, thanks so much, Russ. Yeah.
So good. It's going to help a lot of people. Well, gosh, is there anything else that you want to share, or Chad, that you'd like to chat about?
Man, do we have 3 more hours?
Yeah, right. I mean, we could. I mean, let's break out some wine and let's go for it.
I think
right?
it's the next. We talk about this being a conversation at the bar. I can't wait till the next day. Next time I'm able to sit down and buy you a beer, Russ. Really looking forward to that. For sure.
Absolutely.
All right.
Well, thank you so much for taking some time out of your day to be with us. It's always great to talk to you. It's an honor to have you on our podcast as a first guest, and really enjoyed the conversation. Thank you. Thank you so much.
I appreciate your time, guys. And anybody who has any questions, you can find me on LinkedIn. I'm happy to answer.
Excellent. Wonderful. Thanks so much, Russ.
Great. You got it, guys.